and welcome to yet another session of Family First, where we try to bust all your myths and provide you knowledge free of cost. This is a great initiative by Family First, and I am Shivani Kandwal, dietitian and a diabetes educator. Today, we have Dr. Rajat Trehan, who is a clinical nutritionist and is working in this field since last 10 years. His clinic is in Janakpuri and is in and by the name of Heal Your Body. Today, Dr. Rajat Rehan will tell us how diabetes. We will be talking about myths and fact about diabetes. Can diabetes be reversed or what the precaution should be taken for diabetes? So, Dr. Rajat Rehan, we welcome you here at Family First platform.
Thank you, Shivani, for inviting me here. And I am glad and I'm privileged to be here with you. Thank you.
Great, great. So, like every time we come here every week and we talk about and different topics with the renowned people from the specialist field. So today we will be talking about diabetes. So, Dr. Trehan, the first question is, can diabetes be reversed? As we know, it's a lifestyle disorder. There are two type of diabetes, type 1 and type 2. So, first thing everybody wants to know is, can diabetes be reversed?
Uh, yes, Shivani, it can be. Diabetes is a lifestyle disorder. And nowadays, people are ignoring their health. Moreover, environmental issues are also playing their role. Optimal health does not happen by itself. It needs to be nurtured and guarded. Much depends on the healthy nutritional choices, difficult to make without awareness of principles and some of the science behind them. It is a disease that affects the body's ability to produce or use the hormone insulin. When your body turns the food you eat into energy, it is also called as sugar or glucose. Insulin acts as a key to help transport this to the cells. Now, if you produce little or no insulin or are insulin resistant, too much sugar remains in your blood. And for this, we must first need to understand the sugar metabolism in our body. The carbohydrates, as you know, we eat are broken down into simple sugars like glucose through the process of digestion. I'm not going into the detailed process of digestion.
Right.
It will take much more time. So this glucose can then enter the bloodstream. Under normal conditions, whenever the sugar levels in our blood rise, a signal is sent to the pancreas to release insulin. This hormone acts like a key that triggers the insulin receptors in the cells, allowing the sugar to enter the cell. Now, the higher the level of sugar in the blood, the higher will be the amount of insulin released by pancreas. Right? Now, sugar glucose is the form of energy that our cells can use. It is the food for the cell, without which the cells cannot function. Shivani, as you can imagine, our muscle cells need plenty of energy for day-to-day movements.
Absolutely.
In case the sugar is not fully utilized by the cell converts it into fat, which can be stored for rainy days. That is a day of starvation.
Right.
We will talk about the most common type of diabetes prevalent today. That is type 2 diabetes. Understanding diabetes starts with knowing the difference between type 1 and type 2 diabetes. Currently, 85 to 90% of diabetes are type 2 diabetes. In these cases, nutritional treatment is usually started later in when the allopathy fails, because allopathy used to control the sugar, but the allopathic treatment also start with medicines rather than insulin.
Hmm.
Right? If the
Right.
amount of fat increases within the cell, it stands to reason that the cells do not require any more sugar because it already has plenty of energy stored. Therefore, the fat within the muscle cells prevent more sugar from entering by making the cells insulin resistant. If we continue to eat sugar or carbohydrates, which break down into sugar, this excess sugar now remains in the bloodstream, causing a rise in the blood sugar levels.
Right.
In order to remove this excess glucose, our thirst increases. That is the most common symptom of diabetes. So that the water we drink can dilute the glucose. This is then filtered and the kidneys by the kidneys and is thrown out, and that's why urination increases. This is also a most common symptom of diabetes.
Absolutely.
In order to use the accumulated fat in the muscle cells, the cell must spend some energy to reconvert the fat back to sugar so that it can be used. The only form of energy that a cell can use is sugar, or to be precise, glucose. So, when this fat in the muscle cells rises, it becomes resistant to insulin, thereby causing the blood sugar level to rise. This is called type 2 diabetes. And yes, it can be reversed through phytomedicine and through lifestyle changes.
Absolutely.
Yeah, madam.
Okay, so yes, as Dr. Rajat Trehan has told us that diabetes can be reversed. If you have type 2 diabetes, then it can definitely be reversed because as we said in the starting only, it's a lifestyle disorder. It is because of your wrong lifestyle, your wrong eating habits, and if you are very into sedentary lifestyle, then this kind of condition really happens. Okay, so another thing which I really wanted to know and which a lot of our users have asked us is that how do you reverse diabetes?
Uh, right. I have reversed approximately 100 plus cases, and they do not need any medication for controlling blood glucose. And to reverse diabetes, we need to really understand the exact causes and then stop doing that. Likewise, we need to give up something while starting to adapt for something different. Uh, like, I usually recommend to stop consuming dairy products. Why people are resistant to this idea? लोग मेरे से बोलते हैं अभी कृष्ण के जमाने में भी दूध पिया जाता था.
बिल्कुल.
But the molecules of protein in the milk is similar to the molecules of protein in the pancreas, which produces insulin. And since the molecules of protein in milk is a foreign thing for our body, our immunity system or immune system gets activated and destroy those molecules,
Right.
break up those molecules. And in that process, they break up the molecules of pancreas also, molecules of protein in the pancreas also.
And
And
this is, I think, very interesting for all of our users that milk also creates some issues. So you must understand this from Dr. Trehan. I think this is really going to help you a lot.
yeah, and also I usually recommend oil-free cooking, and people are also resistant to that because of the habit or because they don't know how to do oil-free cooking. Now, to address the issue कि कृष्ण के जमाने में भी दूध पीते थे, वो तो मक्खन चोरी करके खाते थे. आपने भी सुना होगा शिवानी जी.
बिल्कुल.
अगर कृष्ण के जमाने में वो एक ही वाज ए काउ हर्ड, राइट, एंड उसके पास तो दूध की कमी नहीं थी, उसके पास मक्खन की भी कमी नहीं थी, बहुत सारी गायें थी उनके पास, तो उनको चोरी क्यों करनी पड़ती थी? उनको चोरी इसलिए करनी पड़ती थी क्योंकि वो ह्यूमन बीइंग के कंजम्पशन के लिए नहीं थी.
राइट.
जब किसी चीज का अभाव होता है तभी कोई चोरी करता है. तो ये लोगों को समझना बहुत जरूरी है कि डेयरी प्रोडक्ट्स जो हैं उसका हमें जो बेनिफिट मिलना है वो एज ए मेडिसिन हम उसका बेनिफिट लें, ना कि एज ए फूड लेने की कोशिश करें.
Okay.
And another thing is, many people say that milk contains calcium. And you being dietitian, you must be knowing कि calcium किस में ज्यादा होता है.
Right.
If you
Absolutely.
if you take 100 gram of milk, and that contains only approximately 123 milligram of calcium.
Calcium, right.
Approximately that, right? And if you consume sesame seed 100 gram, you will get 170 milligram of calcium.
Right. Absolutely.
Moreover, how much protein do we need? A child, while growing, needs mother's milk. Mother's milk contains 33 milligram of protein, while the cow milk contains 23 milligram. बट यू नो जैसे ही थोड़ा सा बच्चा बड़ा होता है तो मदर का लैक्टेशन बंद हो जाता है.
Hmm.
वाई? बिकॉज अब उसका वो रिक्वायरमेंट पूरा हो गया. राइट.
Right. Right.
कैल्शियम और प्रोटीन हमारे को जितना चाहिए वो हमारे को नेचर देता है.
Hmm.
तो ये मिथ है कि भाई दूध पीने से ताकत आती है या दूध से हमें कैल्शियम मिलता है. ये एक मिथ.
And And anyways, Dr. Rajat, the kind of milk we get these days, it's really not the pure one. In any case, आज के डेट में जो भी दूध मिल रहा है, अगर हम लोग ये कहें भी कि दूध पीना है, या लोग बहुत सारे लोगों को होता है कि नहीं दूध तो पीना ही है, तो इन दैट केस ऑल्सो जो भी आजकल काउज से मिल्क मिल रहा है वो किसी ना किसी तरह से केमिकलाइज्ड, या फिर उसमें आपके एंटीबायोटिक्स हैं या फिर उसमें हार्मोन्स हैं, तो इन एनी केस दैट इज नॉट गुड फॉर एनीबडी.
एग्जैक्टली. ऑक्सीटॉक्सिन एक हार्मोन इंजेक्ट किया जाता है.
राइट.
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 तो वो हार्मोन्स आते हैं. एंड इवन दे extract twice a day milk by the milkman or dairy person, and that creates the tissue damage of cow's udder.
Absolutely.
Right. And that it doesn't heal and it produces pus also. So milk contains pus cells also
Right.
nowadays. So it is better to avoid dairy products.
Right.
If you
Okay.
are a diabetic, if you are healthy, you can keep consuming dairy products. While I am not, personally, I am not taking any dairy products.
Okay, okay, all right. So, as Dr. Trehan has very well cleared and taught us about why not to consume dairy products if you are diabetic, so I think everything is clear to you all. And as I said, that anyways, it's not really healthy because other than the nutrients, we are getting more of the hormones which we really don't want, and especially in the cases if if you have any hormonal issue, so try and avoid that. Okay, so the next question which we have got, Dr. Trehan, is that is there any protocol to follow when somebody is taking, sessions and somebody is taking the treatment from you?
Yes, there is a protocol to follow, and I have told that the first protocol which I usually recommend is to avoid milk, and the second is to do oil-free cooking, right?
Hmm.
And there are other protocols also to follow, like doing the exercise or not being lethargic, and to eat those things which are anti-inflammatory in nature rather than going for pro-inflammatory food.
Right. All right. All right. Great. So, as Dr. Rajat said, it's all about changing your lifestyle and not doing one particular thing, because that's not going to help you. You need to work on all the things all together. You need to do with your exercises also and follow whatever diet schedule also he gives. So, the another
Yeah,
question.
I need to add one more thing. You have to
Yes.
earn the health. कमानी पड़ती है health.
बिल्कुल
Earn.
बिल्कुल.
So what is earn? E for exercise. A for having the attitude which is positive. R for the requisite rest, and N for nutrition.
Wow, wow,
Yes,
wonderfully
लेना
said.
होता है.
Wonderfully said. So you have to earn your health. That's what you need to do. Great. So, Dr. Trehan, this was one question that do you provide only dietary solution or there are any medicines as well?
Yeah, I do provide dietary solution. Dietary solutions play an important role in reversing diabetes.
Hmm.
Apart from dietary solutions, I tell people to do some physical exercise also, and I also give the phytomedicines along with the dietary solutions and the exercise protocol.
आई थिंक अभी आपने बोला फाइटो मेडिसिन, और ये सुनने के बाद बहुत सारे लोगों के दिमाग में क्वेश्चन आया होगा कि वो क्या होता है. दिस इज मुझे लगता है फॉर अ लॉट ऑफ पीपल दे मस्ट हैव हर्ड दिस फॉर द फर्स्ट टाइम. सो आई थिंक उन सबका क्यूरोसिटी जो है उसे कम करते हुए प्लीज टेल अस दैट व्हाट आर फाइटो मेडिसिन.
See, phytomedicines are basically made from phytonutrients.
Right.
Phyto means plant. So plant, the nutrition which plant uses to keep itself healthy is called plant nutrition or phytonutrition, phytonutrients. Now, these are also called as phytochemicals. These are one and same thing: phytochemicals, phytonutrition, phytonutrients, and phytomedicine. These are all same thing.
Right, right.
And
Okay.
these are not actually हमारे लाइफ के लिए बहुत जरूरी नहीं है कि भाई
Hmm.
इसके बिना हम मर जाएंगे, बट इट इज नेसेसरी फॉर आवर हेल्थ.
Right, right. Absolutely. Okay, so as Dr. Tehan has told us that phytomedicines are basically made up of phytonutrients and they are basically the phytochemicals, right? As I said.
या
Right. So these really help and they have a great importance in reversing diabetes. When Dr. Trehan treats somebody, he gives a combination of both the things, which is phytomedicines along with the dietary advice. So how great it is. Okay. And we are really excited to know that how do phytomedicines actually work?
Okay, very good question, ma'am. Before that, I want to tell you how phytomedicines are created.
Okay,
These are
great.
the there is some plant and it is been harvested, and some extraction, crude extraction is made out of that,
Okay.
and crude extraction is made out of them.
Hmm.
Then the standardized extract is taken from that crude extract, fractioning and fractions, and then preclinical analysis and toxicological analysis and clinical acid analysis. Then it is formulated into phytomedicine. If you go and read the journal of phytonutrients, you will come to know how these work.
Right.
Basically, आपने सुना होगा तेज पत्ता.
Hmm. बिल्कुल.
राइट. तेज पत्ता जो है, अभी इसकी एक रिसेंटली एक रिसर्च हुई थी इसके ऊपर फॉर द हाइपोग्लाइसेमिक एक्टिविटी.
Hmm.
राइट. एंड इट हैज बीन पब्लिश्ड आल्सो. किया जिया बी पिटेरो ने इसके ऊपर रिसर्च की थी एंड ही इज द ऑथर. यू कैन गो एंड सर्च इट इन गूगल आल्सो.
Hmm.
एंड मोर ओवर basically for diuretic there is a grass called vetiveria.
Hmm.
So that is used for diuretic. It is also been researched and researched by the, Kavita and Yadav, P.V. Kadam, A.S. Karanze, and M.J. Patil. That has been researched. So phytomedicines are being researched and then they are being made. Now, how do they work? It's a very good question. Phytomedicine, as I told you, is the phytonutrients. And you might have seen many colors of fruits and vegetables.
Right.
Now, how do they work? It's a very good question. Phytomedicine, as I told you, is the phytonutrients. And you might have seen many colors of fruits and vegetables.
Right, right. And they have flavonoids and carotenoids and sulfur.
Exactly, exactly.
Yes,
That's my point. And let us now take the example of garlic. It contains allicin, that is
right.
phytonutrient, right? Which is antiviral, antimicrobial, anti-inflammatory, and many other qualities.
Absolutely.
These are extracted to produce the phytomedicines.
Hmm.
And these phytonutrients, like I told you earlier, are not required for our life. Means our life is not dependent on them, but they are extremely essential.
Because we are generally getting them through our food also.
Yes, but
So,
when we are having any disease or
right.
we are
We
ill,
need it in the concentrated form in that case.
exactly, exactly.
Right. Hmm.
Right. And these phytonutrients or phytomedicines also do not have any side effect.
Right.
If you see the fruit or vegetable of blue or purple color,
Hmm.
these contain resveratrol,
Hmm.
anthocyanidins, phenolics, and flavonoids.
Right.
Right? And the health benefit for this blue and purple color fruits and vegetables is that it supports heart and it supports brain and bone health. And plus, they provide antioxidant protection and healthy aging.
Anyways, great for skin also.
Yeah, great for skin also. Great.
Right. Right.
So, if you see red and pink, so they again contain anthocyanidins, quercetin, allergic acid. These are the fatty nutrients they contain, and the health benefits are they support prostate, they help in urinary tract, and they also keep our DNA healthy.
Okay. Okay, great.
And
So
if you
Dr.
want
Trehan,
that I go and tell more about oranges and other things, so you can allow me if you have time.
right. I think if people would be really happy to know that, but I think that is the reason we always tell people to have a colorful food in their diet and include all the colors of food in the diet so they get the maximum benefits and maximum nutrients for their body, right?
Right.
And if somebody has any medical condition like diabetes or arthritis, in that case, they really work wonder because Dr. Trehan's patients, there are a lot of patients who have reversed their arthritis and their diabetes through phytomedicines and through his dietary changes. So that's really amazing. Great. Okay, so another thing which I really wanted to know, Dr. Trehan, is that do people can lead a normal lifestyle after diabetes is reversed through these medicines and through the dietary changes? Because I just wanted to know that do they still need to continue with the phytomedicines once the diabetes is reversed?
No, they don't require any kind of medicine, and they can keep on doing their normal things. But they still have to keep some uh, restriction, or avoid some food which
Hmm.
may relapse the diabetes.
Okay.
लाइक अभी मैंने एक जो है उनका मैंने डायबिटीज रिवर्स किया था, ही इज इन गुड़गांव, एंड एक अभी 5 साल हो गए उनको. ही इज
Hmm.
नॉट टेकिंग एनी मेडिसिन, नॉट टेकिंग एनी शॉट्स ऑफ इंसुलिन,
Hmm.
and yes, he is keeping their same lifestyle of being active, in doing his exercise, cycling, swimming, playing tennis.
Hmm.
हाँ, लेकिन वो डाइट में थोड़ा इधर उधर गड़बड़ करते हैं, बट स्टिल he is diabetic free.
Right. Amazing. That's really wonderful. That's really wonderful. And how many cases have you reversed till now, Dr. Rajat?
Um, Shivani ji, I have reversed 100 plus, or maybe more than 200 cases, uh, and they do not require or need any medication after reversal for controlling their blood glucose.
Okay, okay, that's really great. That's really great. And I think many of us didn't knew about phytomedicines, I believe. बहुत सारे लोग नहीं जानते थे, जिनको शायद अब पता चल गया होगा. And they must be amazed कि they are such amazing things and you know how they really work with our body. So I'm sure Dr. Trehan, thank you so much for that कि आपने हमें उसके बारे में बताया और इतना आपने उसका information दिया हमको. तो आई बिलीव सब लोग को उसके बारे में पता चला और सब लोग को बहुत अच्छा लग रहा होगा जान के. सो डॉक्टर त्रेहान इज स्पेशलिस्ट इन स्पेशली रिवर्सिंग डायबिटीज एंड अर्थराइटिस. सो इफ you are a family first member, you can get a free consultation with Dr. Rajat Trehan, which is amazing, or you can get your family member free consultation with him. So become a part of family first by just enrolling and being a member of family first in just rupees 599, and you get 4 consultations free from any of the doctor in the panel. You can get the first 4 consultations free, and after that also we give you a lot of priority, and we make sure that you're getting all the benefits. And we will be back next week with another myth busting session with another specialist from the field, and we will be giving you a lot of information and a lot of knowledge. So Dr. Rajat, thank you so much for coming, and thank you so much for telling us so much which we really didn't know before. I think बहुत लोगों को नहीं पता था, so it has been a really amazing and interesting session. So thanks a lot for that.
Thank you Shivani for inviting me here, and
Yeah,
मेरे को भी बहुत मजा आया आपके साथ बात करने में और जुड़ने में. थैंक यू शिवानी जी.
you're most welcome. Thank you so much.